Hello and welcome to Keep Talking, a community dialogue about mental health. My name is Gay Maxwell and I'm the manager of the Office of Continuing Education at the Brattleboro Retreat. The Brattleboro Retreat is a 183-year-old psychiatric and addictions hospital in southeastern Vermont, which serves adults, adolescents, and children in a variety of outpatient and inpatient settings. The Brattleboro Retreat provides care and courage when being human hurts. And today, in the BCTV studio, I have a gentleman by the name of Timothy Wahlberg, and I'm so thrilled that he's here. Dr. Wahlberg is a clinical psychologist. He's also a certified school psychologist, as well as the clinical director of the Prairie Clinic in Geneva, Illinois. And he will be presenting in our continuing education series this fall on Thursday, October 12th in Agawam, Mass. At the Crestview Country Club. He will be presenting on outpatient therapy with children, adolescents, and young adults on the autism spectrum. So I thought, what better place to start than with Timothy Wahlberg to discuss the autism spectrum disorder, which I'm sure many people have questions about. So, Tim, thank you very much for joining us. I know you're taking time out of your day and your patient schedule, and I'm thrilled to see you again. This is the second time you'll be appearing through the Brattleboro Retreat Continuing Education Office in the series, and I'm thrilled to have you back. I just wanted to start off with some statistics that I gathered through some reading and research that I've done on my own. The U.S. Centers for Disease Control and Prevention estimates that 1 in 110 children and 1 in 70 boys in the United States are diagnosed with autism spectrum disorder. And that's a 600% increase over the past 2 decades. According to another article I've read, that there are 500,000 children diagnosed with autism spectrum disorder that will, in the next 10 years, become adults. And I wanted to ask you, how accurate does that sound to you? What is your take on that?
Well, first of all, thank you so much for having me, Gay. I really look forward to coming out in October. I had a blast when I was there a couple years ago. So thank you very much for the opportunity. To answer the question, I think we have to be careful whenever we're looking at statistics and looking at numbers. We're looking at incidence or prevalence of anything with children or with adolescents or even with adults. So when I look at those numbers, I think one thing to be careful of, I've been doing this a long time, and when I was first a graduate student, boy, that was back in the early 90s, the incidence of autism was 4 or 5 out of 10,000 live births. Mm-hmm. So 4 or 5 out of 10,000. I think the difference when you look at the numbers today we're saying autism spectrum. Back then we were saying autism because there really wasn't a spectrum yet. So in 1993, the DSM introduced Asperger's disorder. Asperger's disorder, what a lot of consider higher functioning autism. Now that's been changed a little bit, but back then we had autism and Asperger's disorder. So the numbers from a couple decades ago primarily address the autism, because we were not diagnosing people with Asperger's disorder because it wasn't in the DSM yet. So I think what's happened today, I still think those people were around back 20, 30 years ago, but today we're able to recognize the higher functioning individuals that we weren't able to because we didn't have diagnostic measures to do that back in 93. So in 93, we added that to our diagnostic manual. So we were able to diagnose.
So it's not like autism as a phenomenon is growing exponentially. It's more that we have more tools to recognize it and diagnose it?
Yeah, I think it's both. I think we definitely have tools to recognize it that we didn't before. What I would say to you, the reason I think that the numbers are going up so high is if you let's say that 2 or 3% of the population in public education 20 or 30 years ago was on the spectrum. If that's true and we were not diagnosing them, so we didn't have the tools, but they were there, then what were we doing with them? Mm-hmm. What were we doing with these kids? Because today I can tell you our public education system is overwhelmed by it. We're having trouble managing it. We're having trouble placing these kids. So I think although we're better at diagnosing, I think there are many, many, many more kids on the spectrum for various reasons. much more so than when you and I were in school. There are just more kids around. I think the kids were there, but the system wasn't so overwhelmed by these kids, especially the higher functioning kids. Like here in Chicago, we've had programming for decades for kids that are very severely impaired with autism. Decades, 30, 40, 50 years. What's happening now is we're recognizing the higher functioning kids, and we don't really have placement options for them. It's either mainstream or there isn't a program necessarily to send them to. So schools are under this crunch right now to try to mainstream these students because they're very bright. You know, they have 130 IQs. They're getting 30s on the ACT, but because of the social disability, because of the autism or Asperger's disorder, they can't make it in a classroom with 30 students. It's too overwhelming to them. So the system in and of itself today is really struggling to keep up with the numbers because some argue it's reaching epidemic proportions. Those numbers you read are very high.
Yeah. So Tim, just rolling it back a little bit, explain a little bit about the spectrum. What makes this disorder a spectrum in terms of diagnosis?
I'm going to start with what the DSM is doing with it, and then I'll explain how the spectrum applies to autism in and of itself. So within the DSM is the Diagnostic and Statistical Manual of Mental Disorders. Yes. That's what I use to diagnose any exceptionality. That could be anxiety, depression, schizophrenia, bipolar, autism, ADHD. So there's criteria that have to be met in order to be diagnosed within that manual. We have made changes, but I'll tell you where the spectrum started. So in '93, we had a category in the DSM, it was a DSM-4, called pervasive developmental disorders. So those were disorders that had to be present or manifest themselves in childhood. So they're pervasive, which means lifelong, and they're developmental disorders. Under that category of pervasive developmental disorders, you had autism, which we're going to talk about. You had childhood disintegrative disorder, and you had Rett's disorder. Now in '93, they added Asperger's disorder. So those categories fell under the umbrella of pervasive developmental disorders. Rett's disorder was extremely rare, as was childhood disintegrative disorder. So when we spoke about being on the spectrum, we were talking about autism and Asperger's disorder, which fell under that pervasive developmental disorder category. So what spectrum means, what is just fascinating, I think, about autism, when you look at level of functioning or level of impairment, you can have the same diagnosis. So I can have a child that has a diagnosis of autism, but really has severe cognitive impairments, severe physical challenges, severe self-injurious behavior. And I can also have a kid like I had a few weeks ago who got a 36 on the ACT that also had a diagnosis of autism. So when I look at spectrum, I really break it down to what their functional ability is. So you can be on the autism spectrum and have very low functional ability, and you could be on the autism spectrum and work, in the science department at Harvard.
Yes.
So I think we have to look at where that range is, and I look at it in terms of functional ability. So what we'll describe as somebody as high functioning on the autism spectrum. That means they have, what we would call a normal or above normal IQ. 100 is average, so we're going to argue they have a 100 or above 100 IQ or within 15 points of that to make them high functioning. I have kids that have significant cognitive impairments that would be considered lower functioning. Now, to confuse the whole subject, what they did in 2013, only in America, in the DSM-5, when it came out, they took out Asperger's disorder.
I see.
So in the United States, they took out Asperger's. So now it's called Autism Spectrum. So anybody that meets the criteria of autism spectrum will receive that diagnosis. We are the only one of the few countries in the world that have taken that out, taken out Asperger's out of the DSM. As far as I know, we're the only country that has done that. People with Asperger's are kind of beside themselves because they feel like they've lost some of their identity. If kids or adults or adolescents meet the old criteria for Asperger's, they will still qualify under autism spectrum disorder in the new DSM. Does that make sense?
Yes.
So we're not excluding higher functioning individuals. We've just eliminated that category.
I see.
what they did in the new DSM to receive a diagnosis of autism from 93 to 2013, you had to meet 3 criteria. You obviously had the social challenge, you had the restrictive interest, odd behavior, stereotypical behavior, and then you had a communication challenge. So 75% of the kids would develop language and lose it by about 18 months. They develop a few words, and that was known as Kanner's autism or regressive autism. The other 25% would not develop language at all. So you had to meet those 3 criteria: the social, the odd interests and behaviors, and the communication. For Asperger's diagnoses in 93, you met 2 of those criteria. You had the social challenge, and then you had the odd interests and behaviors. What you didn't have for an Asperger's diagnosis is the communication issue. So most kids with Asperger's within that window diagnostically developed language, but they were they called them little professors. They knew all the dinosaurs. They could spell all the dinosaurs, and they were 3.5. They spoke, it seemed like a very high level linguistically, but they lacked the social language or the pragmatic language. So now in the DSM, we have the 2 criteria for autism spectrum: the social disability, and then the restrictive interest, the sensory issues, the odd behavior. So we've taken the communication component out of it. And now what we do is we rank level severity 1, 2, or 3.
Oh, okay, 1, 2, or 3.
Yeah.
Can I ask you a little bit more about causes? It seems like there are multiple causes of autism, and that they're not really well understood, and they're not simple. That they include hereditary factors, genetic mutations, maybe at conception, environmental exposures. How do you explain the causes of autism spectrum disorder, for instance, to children or to their parents?
Well, I'll try to answer that in 2 stages. I'll try
it's a
to
big
answer
question.
Yeah, my theory on why it happens or why it's happening, why there's more kids, and then I'll explain kind of what I do with families. So when I look at the development of autism, there's 2 types of brain development that we go through as human beings. There's phylogenetic brain development and ontogenetic brain development. Phylogenetic brain development is from however you think we started, whether we crawled out of the ocean back in the day or God gave a rib. We started at some point as human beings. So phylogenetic is from that point thousands of years ago to today. Our brains continue to develop. They got smaller, they get more efficient, and they generally get better at processing what's going on around them. Then we have ontogenetic brain development, which is from birth to death. So I can influence my brain development based on my education, how hard I work, how much I stimulate my brain from birth to death. Does those 2 categories make sense?
Yes.
So when I look at what's changed, people ask me all the time, why are the numbers up? Like I said earlier, one of the things is diagnosing. We're better. But another thing is there's more kids. There's no question in my mind there's more kids with autism than there were 20 or 30 years ago. So when I look at what we've been able to do as human beings is we've adapted to change over the course of the years. So that's the phylogenetic brain development. So if you go back thousands of years looking at those gradual changes and gradual inventions, it wasn't a very fast change or process. When I started thinking about autism, I looked at how I grew up compared to how my father grew up. There wasn't a lot of change. There wasn't a lot of change in diet. There wasn't a lot of change in electronics. My dad had indoor plumbing. I had indoor plumbing. My dad had a TV. I had a TV. My dad had electric. I had electric. And even when I looked at my grandfather, my dad's dad, basically he grew up with a lot of the same things that my dad did. Now, he might not have started with indoor plumbing, but then he had indoor plumbing. Then he had electricity. He had a telephone. And then when I look at what happens that our brains, I think, had trouble keeping up with is all the changes that started to happen in the 70s and the 80s. So we went, there wasn't really fast food. I remember McDonald's coming to my hometown. My dad didn't have that. My grandfather didn't have that. They bought groceries at the grocery store, fresh groceries. Mm-hmm. They didn't buy frozen anything. We didn't have microwaves. We didn't, and I think what's happened is we've changed so quickly that our brains haven't had a chance to adapt. So we have all these additives and preservatives. You can't eat a steak that doesn't have chemicals in it, or fruit, and I don't know that our bodies had a chance to adapt to that. And you couple that with technology. people aren't communicating face to face anymore. They're sending a text, they're
Look at
emailing.
us.
Yeah, well, we're kind of face to face right now, not live in person next to each other, but we still face to face.
That's right.
And I think those have consequences. Though there's consequences to that. They talk about mercury. Mercury was a huge debate with the vaccinations, and I studied that a little bit. And most of the mercury that kids have when they're born come from their mother's fillings, because when we all have mercury fillings from back in the day, and that leaches into your bloodstream, and that has an impact on your fetus. It also has an impact on what we eat. Eating McDonald's and drinking diet soda and all these preservatives that we didn't have before, and plastic bottles. We didn't have plastic bottles 20 years ago that we drank out of. Now we do. We didn't have microwaves. So I think those two things, in conjunction, all of a sudden we have a lot of these kids that are coming in the world, and they're kind of hypersensitive to anything. Their bodies are overstimulated, and they have sensory issues and problems processing the environment. And I think that's why we're seeing an increase in numbers. What I try to explain, so second part of that question is, what I try to explain to families is, basically everything's genetic. When I have a kid in my office, he's made up of his mom and dad. There is no other contributing factors genetically other than his two parents. Now, the genetic makeup that they provide for the child is, we all hope that my kids get the best for me and the best for mom, but it doesn't always work that way. So there's a genetic component. I think there's a nutritional component that plays into it. But what I try to explain to families is, it doesn't so much matter if we know the why behind it. It's what we're going to do about it, what we're going to change. There's some things with diet we could do to make life a little easier. There's a lot of things we can do treatment-wise to make life easier. Sometimes there's medications that help. There's programming in schools that can help. But I'll break it down to a family, and I'll explain the criteria that I talked to you about. I'll talk about some of the statistics and what the numbers look like, what we can do to make a change. And I will tell you, Gay, I'll talk a lot about this in October. Each family is so unique and so different. So I might have a family in my office for 6 months before I feel like they're ready to hear autism, because they're just not ready to manage that yet.
Yes.
With kids, families ask me this all the time. When do I tell my son or daughter that they have autism? And that's very unique to the child. But my philosophy on that is, until the child feels like they're different in some way, I don't know that I want to introduce to them, oh, by the way, you don't know this, but you're very different from all the other kids. So I really kind of wait until a child is saying, hey, why are these kids doing this and I'm not able to? Or why do kids have friends and I don't? Because if you don't tell them what's going on at that point, they will make their own assumptions. And when they make their own assumptions, they're wrong. They think they're dumb, or they're weird, or they've got mental issues. I had a girl in my office the other day saying she has mental issues. Well, you're on the spectrum. It's not about mental issues. It's about a different way of seeing the world. So it really is so dependent on the family. And I luckily in October, I have a lot of time to explain how I evaluate families and what I look at, as far as readiness, or, because they're not all ready to hear it right away, that doesn't mean I can't do treatment. You know what I mean? I can't start educating and doing treatment. But if I say, oh, by the way, your child has autism, whoa, they could be completely overwhelmed. I'll never see them again. And then unfortunately here in Chicago, they will doctor shop until they find somebody that says, oh, no, they don't have autism. They'll grow out of it. It doesn't take much to do that.
Yeah.
So I really want to make sure that the family's ready. And I'm going to talk a lot about this in October. I have to evaluate, why is the family coming in? My reputation, even though, I didn't plan it this way, but, my reputation in Chicago is I'm the autism doctor. So anytime somebody gives a referral to a family, oh, you should go see Dr. Wahlberg, they're like, oh my gosh, my child has autism. You know what I mean? So that's a stereotype I have to work with the families on as well, because believe it or not everybody that comes to see me has autism. But if somebody thinks for a moment a child might have autism, they refer them to me. So when you look at the numbers of kids that walk through my door, there's a much, much, much higher incidence of autism walking through my door, because that's where people are, you're referring to my office. Mm-hmm. Because of that reason, a lot of times.
So I want to talk to you about treatment, but I just want to introduce that idea in the reading that I've done. it has sounded to me as if the most important thing that we can do for the person who has autism is to make sure that they participate in life, that that they oftentimes need help with social skills to increase their connection and a connection to community. And is that the way you work?
Yes. Well, and let me explain how I do that. You're 100% correct. Keep in mind, what separates autism from all other diagnostic categories is it's a social disability, which is a difficulty engaging socially, having friends, reading social language or pragmatic language, joint attention, just engaging with other individuals. That's what separates autism from everything else. So I can have social anxiety, but not have a social disability. My social anxiety, I have social skills, but when I'm around a bunch of people, I get anxious. That doesn't mean I don't have social skills. So what separates autism is that social piece. Here's the catch, though. That is ultimately my goal in treatment, is to improve their social skills. So, I'm gonna talk a little bit about in October how I do social groups, but that's a big part of it. I have 20-some social groups that I run through my clinic.
Wow.
That helps kids learn to engage socially. But here's the catch, Gay. I have to start at kind of a lower level, baseline level of as far as behavior, as far as controlling anxiety, as far as controlling irrational thinking. So I have to teach prerequisite skills in order to get to the social piece. So I can't just plunk a kid down in the lunchroom and say, oh, just sit at the table with a bunch of kids and you'll learn to be social. That's how other kids do it. I cannot do that with a child on the spectrum. First of all, if they can't sit in my group, I have to teach them how to sit and maintain in my group before they can develop social skills. I have to teach them how to listen. The only way we can have this conversation right now is if I can listen to you and you can listen to me. If I'm just doing my own thing in my brain and not paying attention to you, I can't engage socially. So when I break it down, what I'm trying to teach kids to do is listen and then ask a question or engage socially at the simplest level. And Gay, that can take 6 months. I have kids that come to group and I've got their anxiety pretty much in check, but now they're in this group setting. And keep in mind, these are kids that, generally speaking, have never had this experience. They've never sat around with 5 or 6 kids and had a conversation because they're either overwhelmed or they don't have friends. I have multiple birthday parties in my groups all the time, especially in middle school, because that's their friend group, because they don't have friends outside of my group. And what I can do in my group is I can slow the pace down. I can make it so one person's talking at a time and I'm there. I can kind of monitor that. But until I get some of these prerequisite things in check, they're so anxious that the social interaction is just too overwhelming. So it starts with the behavior, controlling the anxiety, being able to listen, because they need those prerequisite skills in order to engage in group. But yes, the ultimate goal is the social. In my practice, Gay, it's rare that I'm talking about, and I work with kids, but it's rare I'm talking about school as far as academics. I'm trying to teach functional skills because being social is the ultimate functional skill. If you're going to have a job, if you're going to live in the community, if you're going to drive, if you're going to go to the store, you have to be able to manage socially. You don't have to be the social butterfly or the most extroverted person in the world, but you have to manage socially. Or these kids and young adults get themselves into trouble. But yes, that is ultimately the goal. That's what separates them as a social.
Well, so let me ask you a couple about some of these myths. Speaking about being social, there's some myths about people with autism, and one of those myths is that they don't want to have friends. People with autism don't want to have friends. Bust that myth for me.
Huge myth. Well, first of all, what I'll tell you, whenever I'm talking about diagnostics with kids on the spectrum, the first thing that I tell everybody is autism does not define them. It's a part of them. Personality comes first. So I don't know if you've seen the numbers on introversion versus extroversion in the United States.
No.
But it's about 50-50. It's pretty much even. Half are a little more towards the extrovert side, half are more towards the introvert side. Well, the kids I see on the spectrum are exactly the same. We stereotype that all kids on the spectrum are the computer nerds. They're up in their class, they're up in their room, they're playing video games, and they don't want friends. That is not true. They want friends, but they struggle making friends. So especially the extroverted kids, they're the kids that are talk. They won't stop talking. They're in the mix, which gets them in trouble sometimes because they can't read social cues, and sometimes they hang around with the wrong people, and they'll say, "Hey, go." They'll tell their friend, "Go in the locker room and take your cell phone and take a picture of the girls." And they'll think, "Oh, my friends are telling me to do that," but they're in the mix. Those are the easier kids to work with socially because they want to be in the game. You described that earlier. I tell the kids, we need to get you in the game of life. Now you have the introverted kids. The introverted kids are a little harder to work with because it's harder to motivate them to be social, but they still want friends. I have plenty of introverted kids that'll sit with their video games and their headsets, and they'll play, computer games online with some kid in Australia. Mm-hmm. So even introverted individuals have friends.
Mm-hmm. Right.
Does that make sense? They don't want a lot of friends. They don't want to go to a big party. They want to sit at the kitchen table with one person. You know what I mean?
Just like people who don't have autism, they're introverts and extroverts.
That's exactly what I'm talking about.
Right.
So I would say across the board, the kids I see want friends. And it's just so difficult.
And how about the myth that kids with autism or people with autism don't have feelings?
That is absolutely not true. Mm-hmm. Keep in mind that the problem, and I'm going to talk about this a little bit with brain development when I come out in October, but, we develop empathy by being around people, by watching people, by reading people. Kids with autism, some have empathy just oozing. I mean, they have so much empathy it overwhelms them. The problem we have is they don't necessarily show it. They don't have the facial expressions to show it. You don't look at them and think, oh, they feel sorry for you. One of the things that they do have for sure is sympathy. So they can feel bad for somebody, and that is not as much of a social thing as empathy. So when you tell me a story and you're sad, I can feel it in my heart. That's empathy. And I genuinely feel sad. That's harder to develop in kids with autism, but they absolutely they absolutely have feelings. I had a kid in the other day, and this is a good way to describe what you're talking about. So I asked him, he's got a crush on this girl. Okay, he's a middle school kid. Got a crush on this girl, and I said, I said, Joe, how much do you like her? And he said, you know what, Dr. Wahlberg, I like her as much as a potato chip. And I thought, there you go. So to show, I don't know that you want to go up and tell this girl that you like her as much as you like potato chips, but, so it's a very black and white way of looking at it. They want to get in relationships, although it feels overwhelming to them. Mm-hmm. They want to have friends. And they have intense feelings. Mm-hmm. They just can't always show it. Yeah. We're not going to visually necessarily see it, but absolutely they do.
So I'm going to need to wrap this up, but I wanted to ask you one last question, which is, is there anything else that you feel like it's really important for people to know about autism, other than what we've talked about so far?
I guess what I would say, I think don't treat them like they're aliens from another planet. They're human beings. Mm-hmm. They're just like you and I. It's what I describe as it's like their volume's been cranked up tenfold. Do you know what I mean? I don't like when people are staring at me that I don't know. If I'm in a restaurant and a stranger's staring at me, I feel uncomfortable. They just feel it so much faster. There's certain frequencies that bother me, like nails on a chalkboard drive me bananas. They have that times 10. And I think we also have to be careful to not take it personally, some of the things they say. Mm-hmm. I think a lot of people think they're oppositional kids, they're defiant kids, they're mean kids. They're just trying to survive in the world. So I think if we could cut them some slack and treat them like human beings, treat them like we treat everybody else, I think that would be great. Because there's some really cool people, Gay. I feel so lucky to get to do what I do every day because I get to laugh, I get to learn. These are such unique kids. The things they say, the things they come up with. There's a whole argument. I read a research study the other day that said 90% of the inventions we have today based in technology come from people on the spectrum. 90%. These are the people that are designing things in the world, creating things in the world, giving us all this technology. And I would say be nice to them. Befriend them. They don't have a lot of friends. Accept them for who they are. They're quirky. They're weird. They say weird things sometimes. They don't mean offense by that. You know, if everyone that said mean things to me that comes to my office, if I had taken offense to it, I'd have retired 25 years ago, Gay. Because it happens, you know, it happens all the time. They don't really know how to manage. So I think we just got to cut them some slack.
Well, thank you so much for joining me today here at the BCTV studio. It's been such a pleasure. I've learned so much from you today, and I hope that our BCTV audience has as well. I look forward to seeing you October 12th, Thursday, October 12th, where you'll be presenting the outpatient program for children and adolescents and young adults on the autism spectrum. So I'm looking forward to that. And again, thank you.
Thank you so much for having me. It was my pleasure, Gay. I'll see you in October.
You bet. You bet. And thank you, our BCTV audience, for joining us once again for an episode of Keep Talking. I hope you'll be back for our next episode. I want to thank the BCTV staff. They are incredible. They make us look good, and they really support us, so I'm very grateful for that. Looking forward to seeing you again. Thanks.